Albert Quevedo is fairly certain he's contracted COVID-19 and is taking a test to find out for sure. He's an oncologist at Tijuana's General Hospital, one of Mexico's pandemic hotspots, and has worked there throughout the crisis.
Me siento nomás un poco cansado, decaído.
I feel tired and weak. I have a headache, a fever, as well as muscle and joint pain.
Dolor muscular y dolor de articulaciones.
He's not especially worried about himself. He's young and fit, but he is concerned about his patients.
Principalmente esta prueba para poder.
I am taking this test so that I can treat my cancer patients who are very ill and vulnerable to infections. I don't want to become a contagion risk to them.
Yet he's not being tested at the hospital itself. He's been sent to a newly dedicated clinic in his own neighbourhood, founded for patients like him. There are now 17 so-called fever clinics spread across the Mexican state of Baja California, designed specifically to separate those with non-lethal COVID-19 symptoms from those in critical condition in the region's already overcrowded hospitals. This way, infections can be contained and the authorities can more effectively track the spread of the virus. These fever clinics are not a local invention. They were pioneered in China and proved effective in helping control that country's outbreak. So the Chinese consulate in Mexico helped local medical authorities here in Baja emulate their model. Now, major cities in Baja all have specialised clinics where residents can go to receive outpatient treatment to get over the virus, learn how to effectively social distance, and even donate antibodies after they recover to help those worse off.
The
Chinese consulate here has shared the experience learned in Wuhan and other parts of the country. Our fever clinics have already attended to more than 2,200 patients, people who would otherwise have gone to our local hospitals, which were already saturated with work. It will certainly help us to better handle the crisis.
As these patients receive test results, they're not only taking the first step in their personal road to recovery, but adding to the vital data being tracked to help slow the pandemic nationwide. Alistair Baverstock, CGTN, Tijuana.